And we're going to be reviewing how to use pregnyl with my patient.
Hi, I'm Morgan and I'm going through fertility treatments.
Okay, Morgan, so we're going to be using pregnyl as your injection, but essentially pregnyl and Navarel, that's all used exactly the same way, it's just a different manufacturer. All right, so upon receiving your medication, you're also going to have a placemat, and the placemat serves as a visual guide, so you're going to see that there's guides on the bottom that say medications, refrigerated, and equipment, so the pregnyl is highlighted in green, that indicates that it's a medication. So when you're ready to use this medication, you're going to open up the box, and you're going to see that you have a powder and a liquid vial inside. Okay, you'll note that the powder vial has a very scant amount of powder inside. Okay, that's not supposed to be. And then you're going to have the liquid vial. Okay, this has no medication at all in it. It's just used to dilute the powder. Okay, so you're going to have leftover liquid in here, and that's fine. Don't be alarmed. It just gets discarded into the schrafts container. All right, after you open up that box, you need to find some additional supplies as well. So you're going to have a 3 ml 22 gauge needle syringe combination, and they're going to be in a bag, and the bag's going to be labeled used to mix and draw up pregnyl. Okay, and then aside from this, you're also going to have a bag of 27 gauge half-inch needles, and that bag's going to be labeled used to inject pregnyl. So it's much smaller, just a needle, no syringe attached. Okay, so you're going to take your liquid vial. You're going to pop the safety cover off of that. You're going to clean the top of it with an alcohol swab. Okay. And from there, you're going to take your 3 ml 22 gauge needle syringe out from the packaging. The first thing you're going to do is pull back on the plunger so you have a milliliter of air inside, or whatever your specified liquid dose is. Yours was 1 ml. Okay. So from there, you're going to uncap the needle. You're going to insert the needle into the liquid vial above the level of the water, and you're going to push on the plunger of the syringe to dispense that milliliter of air into the vial. Okay. From there, you're just going to turn that vial and syringe upside down together, and you're going to pull back until you have a milliliter of the liquid inside of the syringe. Okay. Turn it right side up, remove the needle from the vial. That vial gets discarded into the schrafts container. You can carefully set down this needle and recap it. Then you're going to pick up your powdered vial, pop the safety cover off that one. And once again, we're going to clean the top of it with an alcohol swab. Okay. From there, you're going to take that same needle and syringe, and you're going to go into your powdered vial now. And you're going to push on the plunger to dispense that milliliter of liquid into this vial. Okay? Now, leaving this needle and syringe attached on top, you're just going to pick up the vial straight between your hands and roll it back and forth, kind of like you're warming up your hands. Okay, from there, you're going to take a look at the vial. Make sure all that powder has been dissolved into the liquid. You're going to turn it upside down. Make sure that the needle's below the level of the liquid. You're going to pull back until you have that same 1 ml of liquid inside of the syringe. Turn it right side up, remove the needle from the vial. This vial gets discarded into the schrafts as well. You're going to carefully recap that large 22 gauge needle now. Okay. You're going to twist it off from the 3 ml syringe. This goes into the schrafts container. You're going to take your smaller 27 gauge needle that's labeled for injecting, and you're just going to twist that one onto the syringe. Okay. From there, you'd be ready to do the injection. So the area that you're going to be injecting into is your abdomen. You're going to go 2 to 3 inches away from your belly button, either to the left, the right, or below. Okay, so anywhere in that U-shaped area, just not going above the belly button, you're good to inject. Okay, so go ahead, have a seat. After you select your site, you're just going to clean the skin with an alcohol swab. Okay, then you're going to uncap the needle. You're going to pinch the skin up to create a pocket-like pouch for the needle to go into. You're going to go straight in with that needle, all the way in at 90 degrees. Push on the plunger to dispense your dose. Okay? You're going to hold it there an extra 5 seconds just to make sure that you got everything. Remove it, and the whole thing goes into the schrafts container.